Assalamu alaikum. I'm Marwa Adil. In this lecture, we'll talk about anatomy of female reproductive organs. The female genital tract composed of internal and external reproductive organs. External organs called vulva, while the internal reproductive organs contain vagina, cervix, uterus, uterine or fallopian tubes, and ovaries. External genitalia commonly called vulva and include mons pubis, which is the pubic area, labia majora and labia minora. The vaginal vestibule, which is a space between two labia minora, the clitoris and greater vestibular glands. The mons pubis is fatty tissue overlying the pubic rami, covered by hair-bearing skin. As the pubic bone composed of body and superior and inferior rami, this area is covered by mons pubis. The labia majora are two skin folds on either sides of the vaginal opening, contain sebaceous and sweat glands and also hair-bearing skin. Why is the labia minora? The two folds in between the two labia majora contain sebaceous glands but no adipose tissue. This picture demonstrates external genitalia or vulva. This is mons pubis, this area. There is labia majora, and in between two labia majora is labia minora. The vestibule is a cleft between two labia minora. It's contain the urethral opening and two glands, Skinner's gland and Bartholin's gland, which stands for lesser and greater vestibular gland. Also, it contains the vaginal opening. This is the vestibule. Between two labia minora contain urethral opening, vaginal opening, and two glands, Skinner's gland and Bartholin's gland, also called greater and lesser vestibular glands. The Bartholin glands, called greater vestibular gland, located on either side of the vaginal opening in the vestibule outside to the vagina at the 4 and 8 o'clock position. It's open in the vestibule by duct, contribute to lubrication during sexual intercourse. While Skinner's gland, called paraurethral or lesser vestibular glands, it's located in the anterior vaginal opening. They are considered homologous to male prostate gland. The vaginal opening, called introitus, located in the lower part of the vestibule. This picture demonstrates the vestibule. Type. This is the labia majora, both right and left. In between is labia minora, skin fold, not contain sebaceous, not contain adipose tissue. This is the urethral opening, and in either side is paraurethral gland, this Skinner's gland or lesser vestibular gland. This is the introitus or vaginal opening. From the vaginal opening at the 4 and 8 o'clock is Bartholin or greater vestibular gland. Clear? To talk about internal genital organs or internal genitalia in female, they are located within the pelvic cavity, primarily consist of ovaries, fallopian tubes, uterus, cervix, and vagina. First, start with the vagina. Vagina is a muscular canal surrounds the uterine cervix and open into the vestibule. This opening, called introitus, connect external genitalia to the uterus. This is the vaginal canal, muscular canal, and this opening in the vestibule is called introitus. Anterior, this is the urinary bladder. Posterior, this is the rectum and anal canal. The blood supply of the vagina mainly from branches of internal iliac arteries. The vaginal artery supplies the lower part of the vagina, while the uterine artery supplies the upper part of the vagina. Additional blood supply from internal pudendal and middle rectal branches. The venous drain through the venous plexus into the internal iliac vein, while the lymphatic drain is considered in thirds, upper 1/3, middle 1/3, and lower 1/3 of the vagina. The upper third lymphatic drain to the external and internal iliac lymph nodes, while the middle to the internal only, the lower third of the vagina, lymphatic drain to the inguinal lymph nodes. Second organ in internal genitalia is the cervix. The cervix is cylindrical lower one-third of the uterus. It's a part of the uterus in between the body of the uterus and the vagina. The internal os is a communication between the cervix and the uterus, while the external os communicate the cervix and the vagina. Cervix is composed mainly of connective tissue. This gives support to prevent expulsion of the fetus before term and provides support to the growing uterus. The mucus secretion of the cervix and the cervical opening, there is a mucus secretion. This thickens during pregnancy and gives mechanical barrier to infection. In this picture, this part is the vaginal canal and this is the uterus. This part of the uterus is called uterine cervix. The lower part of the uterus. This internal os communicate between the uterine body and the cervix, while the external os communicate between cervix and the vagina. To talk about the uterus, it looks like pear-shaped, about 7.5 centimeters in length, composed of the fundus, body, and cervix, located at the lesser or true pelvis. The uterine fundus, this is the part, is the fundus, is a dome-shaped part, upper part of the uterus, above to the entrance of fallopian tube. This is the fallopian tube connected to the uterine cavity. Above to this entrance is uterine fundus. The uterine body, this part, or corpus uteri, is the largest part of the uterus. It's a hollow part between the fundus and the superior edge and isthmus inferiorly. It's the functioning part of the uterus, mainly during menstruation. It shed during menstruation, provides that for implantation and future gestation. The uterine isthmus, it's a transitional area between the body and the cervix, and during pregnancy it's formed the lower uterine segment, which is mainly formed at the third trimester to accommodate the fetus, and it represents the area of cesarean section incision in uterine incision. The uterus has a normal position in the pelvis as anteverted anteflex, means it's tilted forward to anterior abdominal wall and rest over the top of the bladder. In the adult, the uterus bends forward on itself at the level of the internal os. This is called anteflexion. This is the angle between the uterine body and the uterine cervix. While the anteverted uterus, this is the angle between the cervix and the vaginal axis. So the uterus comes to lie in almost a horizontal plane. As demonstrated in this picture, the angle of anteversion almost 90 degrees, which is between the uterine cervix and the vaginal axis, while the anteflex angle, which is 170 degrees, between the uterine body and the uterine cervix. As an end result, it provides the normal position of the uterus in the pelvis as anteverted anteflex, which explains the horizontal plane of the uterus. This uterine position is maintained by forward pull on the uterine fundus by round ligament and backward pull on the cervix by uterosacral ligament. There are other varieties of position as retroversion, retroflex, which represent abnormal positions. The uterus movable organ held by four ligaments: uterosacral ligament, as we say, round ligament also, broad ligament, and transverse cervical ligament. Transverse cervical ligament, also called cardinal ligament. These four ligaments hold the uterus in position. These folds represent uterosacral ligaments are two folds of peritoneum extend posteriorly from the cervix to anterior cervix of the sacrum. Broad ligament to either side of the uterus, right and left. connects the uterus to the lateral pelvic wall. The broad ligament contains fallopian tubes, round ligament, and ligament of the ovary. Why is the ovary attached to the posterior layer of the broad ligament? By mesovarium. This is the ovary attached to broad ligament by mesovarium, and this is the fallopian tubes attached by mesosalpinx. The cardinal ligament or transverse cervical ligament connects the cervix to lateral pelvic wall and gives considerable support to the uterus. Also, it carries in its substance uterine artery and vein, uterine nerves, and ureter. This is the cardinal ligament or transverse cervical ligament. This is the transverse or cardinal ligament. Round ligament, the fourth ligament attached or supports the uterus. These round ligaments are cord-like structure, 10 to 12 cm long. It attaches the uterine corona to the labia majora. It's passed through inguinal canal through deep inguinal ring. It's one of the content of the broad ligament, as we say. This is the round ligaments from uterine corners to labia majora and enter the inguinal canal through deep inguinal ring to superficial inguinal ring. These four ligaments support the uterus. The blood supply of the uterus mainly from uterine artery, which is a branch of anterior division of internal iliac artery. This uterine artery gives off branches to the cervix and upper vagina, also anastomose with the ovarian arteries to supply the uterine fundus and fallopian tubes. The uterine vein accompanies the artery and drain into internal iliac vein. This uterine vein communicates with the ovarian, vaginal, and vesical veins to form what we call pelvic venous plexus. The lymphatic drainage of the uterus is a wide field mainly to the iliac lymph nodes and para-aortic lymph nodes. The para-aortic lymph nodes mainly to the uterine fundus and fallopian tubes, which accompanies the ovarian lymphatic drainage. As we talk about the cervix and uterus, we'll talk about uterine or fallopian tubes. These tubes situated at the upper margin of the broad ligament. As we say, broad ligament contains the fallopian tubes, round ligament, and ligament to the ovary. These tubes approximately 10 cm long, made of four parts: infundibulum, ampulla, the isthmus, and interstitial or intramural part. This is the uterine tube or fallopian tubes. Connect between the uterine cavity and peritoneal cavity. This intramural or interstitial part is the narrowest part, almost 1 cm in long and less than 1 mm in width, embedded in the myometrium of the uterine cavity or uterine body, above to which is the fundus and below is uterine body. The isthmus is 2 to 3 cm long between the ampulla and the interstitial part, and this part is the ampulla of the uterine tube. It represents the site for fertilization that usually occur at ampullary part and contain cilia that aid in transfer of the zygote to uterine cavity. The last part of the uterine tube is infundibulum. It's funnel-shaped and open in peritoneal cavity near to ovary to catch the egg after ovulation. The blood supply of the uterine tube with plexus between ovarian artery and uterine artery. Ovarian artery supplies the lateral part of the uterine tube and the proximal or medial part supplied by uterine vessels, while lymphatic drainage mainly follows the ovarian lymphatic drain to the para-aortic lymph nodes. The ovaries are female reproductive glands or gonads are endocrine organs, almost almond-shaped organ situated on either side of the uterus, close to the lateral pelvic wall. Almost 4 cm in length, each ovary attached to the posterior superior aspect of the broad ligament by mesoovarium. Also, the ovary has two other attachments, infundibulopelvic ligament and ovarian ligament. Infundibulopelvic ligament or IPL, also called suspensory ligament, it attaches the ovary to the lateral pelvic wall. It contains the ovarian vessels, lymphatics, and autonomic nerves. The ovarian ligament attaches the ovary to the uterine body, while the ovarian ligament attaches the ovaries to the uterus. So, mesoovarium connects the ovary to the broad ligament, IBL or suspensory ligament connects the ovary to the lateral pelvic wall, while ovarian ligament attaches the ovary and uterus. The ovary in the pelvis located at depression called ovarian fossa on the lateral pelvic wall. Its clinical significance is that it's bordered by important structures, mainly external and internal iliac vessels, ureter, and contain obturator nerve. The ovarian fossa borders anteriorly by internal and external iliac vessels and contain obturator nerve. Other significance of this ovarian fossa is used as a landmark to locate the ovary during pelvic imaging and pelvic surgeries. The blood supply of the ovary directly from the aorta below the level of renal arteries, while the venous drainage of ovaries is different. The right ovarian vein drains into inferior vena cava, while the left ovarian vein is open or drains into left renal vein. This is due to asymmetrical development of the venous system in the embryo, in which the left inferior vena cava regress intrauterine. The lymphatic drainage of the ovaries to the para-aortic lymph nodes at the level of the renal vessels. This arrangement of the blood vessels and lymphatics are explained by the development of the ovaries from the genital ridge at level of L1, which is abdominal, then descend to the pelvis, dragging its blood supply, lymphatic drain, and autonomic nerves from the level of the T10. The ovarian veins, right ovarian vein to the inferior vena cava, while the left ovarian vein to the left renal vein. Type autonomic nerve supply of the uterus and internal genitalia. To talk about sensory fibers and motor fibers. Sensory fibers of the uterine body via hypogastric plexus and hypogastric nerves, right and left, while sensory fibers of the cervix and upper vagina via pelvic splanchnic nerves, but sensory fibers of the lower vagina and perineum via pudendal nerve. The motor fibers of the uterine body and fundus, which is the upper part of the uterus, are sympathetic in origin, while the upper vagina and lower uterine part are parasympathetic, traveling with pelvic splanchnic nerves. The motor fibers of the lower vagina and perineum are somatic, traveling with pudendal nerve. This is the end of this lecture. Thank you.